Hi, everyone. My name is JD Demore, and I'm a strategic project manager with the Behavioral Health Administration. On behalf of everyone at BHA, I'm excited to share this short presentation on the new Colorado LIFTS network, an exciting and transformational update in Colorado's behavioral health care system. Today, you'll learn more about Colorado LIFTS from me and my colleagues, Alyssa Hetchel and Kayla Martin. You'll hear why this change is necessary and exciting, and how the LIFTS model works. We're excited to share this next chapter with you and continue working to build a system that meets the moment and the needs of every person in Colorado. We will begin by answering a critical question. What is Colorado LIFTS? Colorado LIFTS, linking individuals and families to services, is Colorado's streamlined network of behavioral health care for uninsured and underinsured people in Colorado. The network includes providers who offer crisis, substance use, and mental health services. Anyone in Colorado, no matter their location or insurance status, can connect to a Colorado LIFTS Care Navigator to receive support and guidance in finding the behavioral health care that they need. LIFTS is coordinated and funded through the Behavioral Health Administrative Service Organizations. Thanks to data collected from behavioral health providers across the state that receive public funds, we know that Colorado's need for behavioral health services continues to grow. In the next year, we anticipate that around 250,000 people will seek immediate support through the 988 Colorado Mental Health Line, that nearly 111,000 uninsured or underinsured people will need mental health services, and that just over 40,000 underinsured or uninsured folks will seek support for substance use disorder. BHA's role is to make it as easy as possible for all of those people seeking support to have easy access to high-quality behavioral health care. But for a long time, Colorado has had a fragmented and complex system that separated crisis, substance use, and mental health support into different networks. This complexity made it hard for help seekers to navigate to care, made that care more fragmented, and resulted in inconsistent requirements for providers and increased administrative burden. Coordinated and funded through the Behavioral Health Administrative Service Organizations, Colorado LIFTS streamlines that fragmented system, and for the first time, will make care navigation services available to all people in Colorado.
On this slide, you see a very simplified visual representation of the new system. At the top is BHA, providing oversight of the entire behavioral health landscape. BHA selects and partners with Behavioral Health Administrative Service Organizations, or BASOs, one in each of 4 distinct regions around the state. The BASOs then contract directly with behavioral health providers in their region to create the Colorado LIFTS network, which includes crisis, substance use, and mental health support. The BASOs are also responsible for managing the Colorado LIFTS Care Navigation phone lines. As you saw on the previous slide, each BASO is responsible for one or more of the 4 regions in the state. This approach will allow each BASO to work closely with the regional council to ensure that the Colorado LIFTS network is composed of a mix of behavioral health providers that can meet the unique and diverse needs of different communities around the state. At the same time, the BASOs will work extremely closely together to ensure that the regions are deeply interconnected, to ensure that the Colorado LIFTS network can serve as a true safety net of services covering the entire state. Region 1, shown here in blue, will be managed by Rocky Mountain Health Plans. Regions 2, 3, and 4 will be led by Signal Behavioral Health Network. Now that we've outlined the model, let's talk about how people can get connected to Colorado LIFTS. There are 3 options. One is the Colorado LIFTS Care Navigation Line. This phone number will take individuals directly to a regional care navigator who will help them take the next step towards the care they need. Care navigation lines are open Monday to Friday, 8 a.m. to 5 p.m. To find the regional care navigation line number, help seekers can visit ownpath.co and enter their zip code. It's important to note that the care navigation line is not a crisis line. Anyone in need of immediate support should contact 988 or 911. The second option is the OwnPath Care Directory. For help seekers who are more comfortable conducting their own search, the OwnPath Care Directory uses zip code and service type to give users a list of behavioral health providers in their area. Providers in the Colorado Lifts network, providers who receive public funds to provide care to uninsured and underinsured people, will be identifiable through an icon next to their name and information. The third option is provider screening. A behavioral health or medical provider the individual or family is seeing could determine that the individual would benefit from further care navigation. The provider will connect the individual directly with the regional care navigation line. So once a help seeker has connected with the Colorado Lifts Care Navigation Service, there are a few different possibilities for next steps. If the person calling the line is in need of immediate support, the care navigator will provide a warm handoff to the 988 Colorado Mental Health Line. If the help seeker is a Medicaid member, the care navigator will provide a warm handoff to Health First Colorado. If a help seeker has private insurance, the care navigator will work with them to determine the most appropriate next step in contacting their insurer. And finally, if a help seeker is uninsured or underinsured, the care navigator will assess the level of support needed and connect the help seeker to the appropriate provider in the Colorado Lifts network.
Speaking to the tiers of care within the Colorado Lifts network, the following is an overview of the 3 tiers. Tier 1 is straightforward care navigation. This is brief, temporary support in connecting to services and social supports. Tier 2 is care coordination. This is an ongoing individualized care plan in collaboration with the individual with warm connections to care and follow-up for continued needs. Tier 3 is care management. This looks like regular, frequent support from a clinical team, more robust and intensive individualized service plan that is driven by the individual. Through this tiered process, individuals and families can be matched according to need instead of a one-size-fits-all approach, truly making this care navigation process unique and individualized. Once the care navigation has occurred based on tier level, the individual or family is connected with the appropriate Colorado Lifts provider. Colorado Lifts providers will accept the referrals, provide care, and may have an ongoing role in the individual's care coordination or care management. In summary, there are 3 key impacts that the shift to Colorado Lifts will have. Number 1 is that there will be fewer steps to accessing care. People in Colorado should be able to get to the care they need quicker. Number 2 is a streamlined system that benefits people and providers with greater connectivity and reduced administrative burden. Number 3 is the focus on care coordination that addresses the holistic needs of an individual and family, better supporting the people in Colorado on their journeys to whole person health. Again, on behalf of everyone at the BHA, I want to thank you for your time in learning more about the Colorado Lifts network and the ongoing transformation of Colorado's behavioral health system. Should you have any questions, you can refer to the FAQ document linked in this slide and available in your toolkit.